Sure, Green. So it gives me great pleasure to speak to my good friend Carina. Carina is based in the States, and Carina has been to the UK before, where she taught a really inspiring and brilliant course looking at bowel and bladder problems in the younger patient, both in kind of toddlers to teens. And Carina was going to do this for us again this year, but COVID-19 has come and affected all of us. So we're both very adaptable people. So we decided cancellation wasn't in our vocabulary. So we decided that we would move it online. And Carina's done a lot of online teaching. I've done a lot. So we're really excited about that. And Carina, can you just tell us what's going to be in that one-day live online course?
Yeah, so before I was a pelvic floor physio, I was a pediatric physio. And when I started learning how to be a pelvic floor physio, I realized that there was a huge gap in care, in bowel and bladder care for the pediatric clients, both typically developing kids with neurologic dysfunction. There was really a lot of questions going around by parents, and even the women that I was treating for their postpartum back pain or their postpartum incontinence were like, yeah, now I need to potty train my kids. So how do I do that? So I developed this course, and this one day is a nice introductory course. So we'll talk about kind of the basics of the development of the urinary tract system, how kids develop awareness of bowel and bladder function, and really how you can do some very basic things to treat the pediatric population. So this is a nice for anybody who maybe isn't going to treat kids a lot, or is just looking to kind of get some tips and tricks, maybe even for their own kids, or even pediatric physios that maybe just want to be able to offer some advice to families. That's kind of what this course is. It's a really nice kind of entry level and soft entry into pediatrics. And then that way, hopefully you'll want to take some more of my advanced courses afterwards.
Yeah, because I think when you did that course for us before, there were some, because of the nature of the course, there were some really, really experienced pelvic health physios at it. And they thought it was quite just incredible. And people said that to you, Lisa, yeah, who's really vastly experienced, said just a brilliant 2 days with you. Obviously, yeah, you're doing 1 day this time, but, and I think also it highlighted to me that, a lot of the patients we see as adults, those things like constipation, urinary habits, bowel, a lot of them some of them may take origin in earlier on in life, and it kind of, doing that pediatric course helped us in the clinic to kind of develop a pediatric service, which is going well. And I strongly believe it's helped me manage more of my kind of adult pelvic health caseload, especially the men.
Oh, I totally agree, because I feel like a lot of the issues that I see in adults as well, a lot of those bad habits were kind of set up in childhood, and they'll, I always am amazed when I am doing, my kind of subjective interview with people, and one of the first things they'll say is, oh yeah, I've had problems with pooping since I was a kid. And so I immediately go back to that and say, well, what kind of problems, and really explore that. And that is, so even if you're not going to treat a ton of kids, this course, especially the 1 day, is really going to help you get a better understanding of how some of these pediatric problems develop, how to intervene earlier, but then also, even if you're just treating the adults whose problems originated in childhood, kind of what things do you have to go back and fix, essentially, because those things started. So it's really good. And I talk really to, because I, as a pelvic floor physio, when I treat kids, I don't look at the pelvic floor as much, and this from taking my course. Yes. I look at the whole body. And so even if you're uncomfortable with maybe seeing kids for pelvic floor specifically, I'm going to give you a lot of strategies and other muscle groups and other exercises that you can do to address bowel and bladder without ever having to necessarily look at their pelvic floor. So
yeah, and I think what surprised, like just to finish you, what surprised me about that course with you was that if that came across more as a kind of pediatric neurodevelopment course, like stages of development, those key motor skills development, rather than a pelvic health course. So that was really enlightening. So Carina, big thanks. Great to catch up.
yes,
We all see a lot about the States in the news, and hopefully things will start to improve over there. So, and thank you very much.
thank you.